Good afternoon, and thank you for joining us for this very special edition of the Nevada Immunization Learning Exchange webinar series, Super NILE Flu Edition. This is Brianne Van Dyne, the Education Manager for Immunize Nevada, and I will be today's moderator. The flu-focused theme of this week's NILE webinars was purposeful. The convergence of flu with COVID-19 fast approaching, communicating the importance of influenza vaccination is more important than ever. Immunize Nevada is excited to be a part of the efforts to promote influenza vaccination coverage rates in our state and beyond for the 2021 season. Before we get started, I'd like to review a couple of housekeeping items. First, if we should become disconnected for any reason, please call right back or log right back in and we will continue. Second, please locate the Q&A box at the bottom of your screen. If you have any questions, type them there and we will address those questions at the end of the presentation. Additionally, if you have requested continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended, or in the post-event follow-up email. All CE certificates will be emailed out within the next week. Please note this webinar is being recorded. The archived presentation and slides will be available on immunizenevada.org/NILE within 1 week. Before we officially begin, I'd like to provide a little disclaimer. Immunize Nevada's NILE webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and goal is for community partners to gain knowledge on immunization and infectious disease-related topics through a non-branded, unbiased presentation. And with that, I'd like to officially begin today's featured presentation, 2021 Flu Season Kickoff in Nevada, Lessons from Last Season and How Our State Can Increase Flu Vaccine Uptake. I'll now turn it over to our very first presenter, Max Wegner. Max is an epidemiologist with the Nevada Division of Public and Behavioral Health's Office of Public Health Informatics and Epidemiology, or OPHI, and is currently working as the influenza coordinator for the state. Max has been working in the public health field for the past 7 years and holds a Master of Public Health degree from the University of Nevada, Reno. His current work is focused on leveraging public health surveillance and working with local health authorities to monitor and respond to influenza in the state of Nevada. Welcome, Max.
Hi, thank you for having me.
Sure thing. Take it away.
Thanks. If we can, go to the next slide, it'd probably be. Thank you. So again, my name is Max Wegner, Influenza Coordinator for the Office of Public Health Informatics and Epidemiology. Today I'll be presenting the 2019-2020 Nevada influenza season, a summary, updates, and as well as this coming season's expectations. Next slide, please. So the outline today, I'll just introduce everyone to the flu, terminology, things like that. We'll get into data from our last season, the 2019-2020 season. We'll talk about COVID and its impact on last season and expectations for this coming season, and other ways to look to the future, especially for this upcoming season. Next slide, please. Reporting requirements for flu. These come from NAC 441A, paragraph 575, influenza. So prior to the 2019-2020 flu season, all cases of influenza were reportable. This included cases with the presence of influenza viruses in clinical specimens tested by medical laboratories using either viral culture or PCR, or those with the positive rapid influenza test in patients with influenza-like illness, or ILI. You can see that there's a big change that took place. So during the 2019-2020 flu season, now what's reportable according to the NAC 441A is hospitalized influenza cases that are under 18 that die, so pediatric deaths related to influenza. Strains of influenza that possess a pandemic risk, those are determined by a CDC or WHO. strains of novel influenza or those that are untypable, and any influenza outbreaks. Next slide, please. So before we get into the data that was for the 2019-2020 season, we'll just go over data sources and where we got our information from. So one of the data sources we get our flu data or ILI data is ILI.net. It's a Sentinel surveillance site used for ILI, and we'll be defining that in a later slide. Also, it provides us with influenza type from Sentinel Labs, so it gives us our virologic surveillance as well. We use Essence, which is a syndromic surveillance system that uses chief complaint and diagnostic diagnosis data, such as ICD-10 codes from hospitals and other health facilities around the state. And that gives us additional ILI patient information based on their patient category. And we'll define that too, but that's those who are seen in emergency departments, inpatient and outpatient as well. We also use FluView dashboards, which are managed by the CDC. It's influenza surveillance data compiled again by the CDC from states, the locals and territorial health departments, public health and clinical laboratories, vital statistics offices, healthcare providers, clinics, and emergency departments. We also use this information to collect our pneumonia death and pneumonia cases at the state, regional, and national levels. And importantly, probably most importantly, we get our information or our data and information from local health authorities around Nevada, the 4 jurisdictions, and their flu coordinators, which report hospitalizations and deaths as well. Next slide, please. Here are the definitions that we use. So for ILI.net, for someone with influenza-like illness or ILI, it's just a fever of 100 degrees or more with cough or sore throat without a known cause other than influenza. In essence, it looks a little different, but pretty similar since it uses those ICD-10 codes. So the ILI that we use for Essence are those either diagnosed with influenza or they have that same ILI syndrome definition with fever, cough, or sore throat with a non-ILI, without a non-ILI fever. It's confusing, but it's the same as above. And then it does it again by patient class, emergency department, inpatient, outpatient, and other. And then finally, hospitalizations. Those are defined as anyone who is hospitalized and test positive for influenza. Next slide, please. Before we get into what was reported in the 2019-2020 season, we'll have a disclaimer about COVID and how that impacted reporting. So COVID led to delays or incompleteness of influenza reporting in all levels of public health. So please consider this while with the following information. So first we'll get into ILI reported for last season. So the top graph is ILI reported from our Sentinel providers, and the bottom graph is ILI reported from our syndromic surveillance system, Essence. So the top graph, a couple of key things to look at. So the last season is bold and in orange. You can see that there was a, compared to the last 5 seasons, there was a sort of an early increase in ILI cases in our state around there's spike between weeks 44 or 45 to 49, and then it dips down towards the middle of the season where other seasons had their increases, and then we had our increase around week 10 and then dropped off around week 11 and 12, which we'll get into in a later slide, but that's when our COVID response took place in our state. For the syndromic surveillance graph, we can see that it has a similar shape to the top graph. And an important takeaway is most of these patients were seen in emergency rooms, and a lot of the outpatient cases that we saw were early on in the season compared to later in the season as well. Next slide, please. So hospitalizations, these are again reported by the local health authorities. The 4 that are listed below in the top graph shows which jurisdiction the hospitalizations came from, and it's color coded. You can see no surprise that most of the cases were in Southern Nevada Health District, which is our biggest health jurisdiction in the state. And you can see that again, it's spiking when we had our ILI cases kind of spike around week 45 or 47, and then with the spike in cases or hospitalizations around week 5. The below graph shows the influenza type by hospitalization. And so the dark blue that you see towards the beginning of the flu season is influenza B, that's not subtyped. And then it moves into influenza A, not subtype, along with H1N1 flu, which is what the rest of the nation saw later on in the season. There was a lot of 2009 H1N1 influenza reported nationally for the last season. Next slide, please. So then we get into deaths that were reported. These again come from the local health jurisdiction. So 61 deaths were reported statewide, again, from our biggest health jurisdiction, Southern Nevada, followed by Washoe County, and then Carson City, and then the rurals. You could see that, well, on this graph, it's pretty intermittent, deaths that were reported, but compared to last season, we had 49 deaths. So we had an increase in the amount of deaths related to flu this season compared to the previous or the past season compared to the season before. Next, please. And then finally, age group. The season was, so here's another important finding is after looking at all the ILI cases by age group, we can see that our cases were fairly young. So between 0 and 24 was 62% of our ILI cases for the whole season. And the bottom graph is our syndromic surveillance again from Essence. And you can see that towards the start of this season, we had more of that younger group being reported compared to later in the season. So you can see from weeks 41 up until about week 9 or 10, it was that young group, and then all of a sudden we got older cases later on in the season. Next slide, please. So COVID and its impact on 2019-2020 season. So again, due to COVID and declaring a state of emergency, there was closures of non-essential businesses and statewide stay-at-home orders, which led to what we think was a potential drop in influenza hospitalizations, as well as we'll see in these graphs on the right, ILI cases seen in health facilities as well. Additionally, it's kind of the disclaimer we went over earlier, the workforce needs of COVID-19 response and influenza reporting may have been delayed or incomplete. And again, that's at every level, local, state, and federal level as well. So on the right side, it's kind of small, I apologize for that, but you can see that the yellow line indicates the ILI ED visits from our Essence syndromic surveillance system, and the gray line is the hospitalizations reported from our locals. The solid black line shows when the state of emergency, around the time the state of emergency was declared for Nevada, and the dash line shows the closures of non-essential businesses and stay-at-home orders, along with the use of and promotion of wearing masks, gloves, washing hands, just the mitigation efforts. And you can see from there, we had a steep drop-off of our ILI ED visits right after those changes took place, as well as hospitalizations. And then looking below at the graph of the blue line, that's our percentage of ILI reported through ILI net. And you can see once COVID response took place, again, we had a decrease in the percentage of ILI reported. This could mean that there's it could be that, again, those mitigation efforts helped with, prevented the spread of flu at the same time preventing COVID. But another important thing to note is this is towards the end of the flu season as well. So maybe our cases were already going down, but as you'll see in the next slide, I'll be cautiously optimistic and say that hopefully these mitigation efforts continue for the next season. So next slide, please. So looking ahead, just improvements to the flu surveillance program or flu surveillance in general. One improvement would be increase the Sentinel site participation. So if anyone has a facility or provider they know, or if anyone listening is a part of a facility or a provider that would like to join, you can please email me here. This is my state email address, mwegener@health.nv.gov, and you can just send me a request to be added, and then we can send you some information on going forward from there. Also, based on conferences, the CSTE Influenza Conference, they would like to see an increase in subtyping at state labs to enhance their virologic surveillance and assess this data at a geographical level, so they can look at it on a state level and nationally. And another thing that we will strive to do is improve integration of reporting systems, including the ones we just showed, ILINet, Essence, local health data, as well as some CDC updates as well. Next slide, please. Thank you. So looking ahead for the 2020-2021 flu season, it's obviously going to be a lot different as far as well, having COVID involved at the same time. So with COVID during the flu season, testing measures to differentiate both will be important to have developed and in place. Co-infection impact is unknown. That's why the flu vaccination is more important than ever this year, just because of all the unknowns that surround COVID and flu. But again, like I said earlier, I'm cautiously optimistic about this coming flu season. The Southern Hemisphere reported that they experienced a very mild flu season during their season, and even reported some places historically low flu numbers. So, and looking at the previous slide, using the mitigation efforts or prevention efforts with the masks again, with more people hopefully washing their hands, social distancing, that we'll have both decreasing COVID cases and knock on wood, we'll have ourselves a mild flu season as well. So as far as vaccine recommendations, no real changes in the CDC's recommendations for the timing of the flu vaccine. So September or October are the ideal times to get it, and that is extended into January or February. So it's not, by that time, it's a lot of people think it's too late to get it if it's around January, February, but it's still recommended by the CDC. If you haven't got it by then, you can. And then the only big difference is vaccination sites may need to change how they roll out or how they perform based on COVID precautions and how they have their patients coming in for their vaccines. So for the 2020-2021 season, these are the vaccinations and the updates for those vaccinations, similar to last season, just with a few updates here in the fine print. Next slide, please. So before I end, I would just like to thank all of our Sentinel providers, the syndromic surveillance providers, all local health authorities, and the flu coordinators there. The immunization program, including Immunize Nevada, our laboratory partners, and just all the health facility staff and providers in Nevada that continue to work with COVID and have to now work with flu on top of that. So thank you for letting me present, and I'll just take questions, I guess, at the end. So.
Thanks, Max, for that great information. As a reminder to attendees, if you have any questions, feel free to type them in the Q&A box, and we will address those at the end. I'd like to now introduce our second presenter, Dr. Pam Forrest. Dr. Forrest graduated from I'm going to butcher this name. Sorry, Dr. Forrest. Juniata College with a degree in molecular biology and received her medical degree from Temple University School of Medicine. After a rotating internship, she was called to active duty in the U.S. Air Force, where she served as a general medical officer for 6 years. Prior to working for the state of Nevada, she was the medical director of a hospital-based occupation health program. And for the past 13 years, she has occupied the role of Provider Quality Assurance Manager for the Nevada State Immunization Program. Thanks for being with us, Dr. Forrest.
Thank you for the introduction, Brianne, and you did very well pronouncing Juniata.
Okay.
Okay, next slide, please. All right, I thought I'd spend the next couple minutes talking about the various flu vaccine presentations, flu vaccine and various age groups, and then finally we'll talk about how to increase influenza vaccine immunization rates in your practice. Next slide. Just a little bit of history. In the 1940s, the U.S. Army went to University of Michigan and asked two researchers, Dr. Francis and Dr. Salk, to develop a flu vaccine for the Army troops. The 1918 flu was particularly devastating for the Army. They lost a lot of troops. So they wanted to protect them. And the original vaccine that the doctors developed for the Army had one influenza virus, and it was influenza A in the vaccine. In 1945, the inactivated influenza vaccine was licensed for use in civilians. So we have benefited for the last 75 years because of the development of flu vaccine. Next slide, please. Okay, so your mission is to, by Nevada Day, get your dose of seasonal influenza vaccine, get your patients vaccinated, get your friends and family vaccinated with flu vaccine. It's very important for healthcare providers, especially, to get flu vaccine by Nevada Day. We hope to have coronavirus vaccine in November. We don't know for sure, but just in case we do, we want to have flu vaccine out of the way so that we can focus on the coronavirus vaccine. And I listened to one conference where Dr. Jay Butler of the CDC said you cannot co-administer seasonal influenza vaccine and coronavirus vaccine. So I want everybody to make it their mission to get you and your loved ones vaccinated by Nevada Day. Next slide, please. As Max mentioned, our flu vaccine now has 4 different influenza virus particles contained in it. It's just the hemagglutinin from the viral capsule that's included in the vaccine. And the 3 influenza strains listed here in blue are new to the influenza vaccine this year. Every year, the influenza virus changes just slightly. So we have to change our vaccine to create antibodies that will take care of the new influenza virus. If you had a flu shot last year, you're not protected this year. You need to get vaccinated every year. Every year in late February, beginning of March, the experts meet and they select which influenza, H1N1, H3N2, Victoria, and Yamagata lineages to use in the upcoming year's vaccine. Many years they are very successful and they select the correct viruses. Other years they may not pick the correct viruses that are circulating, and then we have a mismatch. So hopefully what our experts picked this past February and March, hopefully the vaccine will cover the viruses that are circulating in the upcoming season. Next slide. Next slide, please. Okay. This is a chart from immunize.org. If you have never visited immunize.org, please do. There's a wealth of resources there for providers. And also there's information to share with patients. So this is the chart that immunize.org develops every year, and this is the chart for this flu season. On the left-hand side in the first column, you'll see the 4 manufacturers that have prepared flu vaccine for this coming season. The second column lists the trade name and then the vaccine abbreviation. I'd like to go through each abbreviation so you know what you're looking at. LAIV4 stands for live attenuated influenza vaccine, and 4 means there's the 4 different types of hemagglutinin contained in that vaccine. The next vaccine down is abbreviated IIV4. That stands for inactivated influenza vaccine. And there's, again, the 4 different viral particles contained in the vaccine. The IIV4 products are all, the virus is all generated, it's grown in chicken eggs. The next vaccine down is RIV4, that's recombinant. The viral particles are grown or developed or formulated in insect cells and gathered for the vaccine. As we go down the chart, IIV4-HD stands for inactivated influenza vaccine quadrivalent high dose. So that has extra viral material in it to generate a more robust response, immune response. As you look down further, AIIV3 and AIIV4, this product has an adjuvant in it. Adjuvants cause our immune system to wake up and give a more robust response. This is the only product that it comes in trivalent, whereas all the other products that you notice here are the quadrivalent, or the 4 different hemagglutinins are contained in the vaccine. And then finally on the list, CCIIV4 stands for cell culture. This vaccine, the particles for this vaccine are grown in canine kidney cells. So this has no egg protein in it either, because the viral particles are not grown in chicken eggs. The next column lists the dosages for each product, and you'll see the majority of our products come in single-dose syringes. The next column lists the mercury content. Mercury is used as a preservative, and that is only found in your multi-dose vials. The age ranges for each product vary, and so you can refer to this list to make sure that you're using the correct vaccine product for the age group that you serve. And then the final column I'm going to talk about is a CVX code. If you have an electronic medical record and you have to put the vaccine inventory in your electronic health record, you have to associate a CVX code with it. Make sure you pick the correct CVX code. I had one provider last year who picked 186, even though they didn't have that product, and it looked like everybody in their practice got Flusovax, including 6 months old. And you can see that's not licensed for that age group. So when you're documenting your flu vaccine in your inventory, in your EMR, make sure you get the right code. And you can refer to this chart to find that right code. May I have the next slide? Okay, so this flu season, who should get a flu vaccine? everyone 6 months of age and older, unless, of course, a contraindication exists. Next slide. I'm going to talk about special age groups, and the first one I'm going to talk about are 65 years and up. We have three products that are licensed for just 65 years of age and older. The first one is the Fluzone High Dose. As I mentioned before, this product has 4 times the amount of hemagglutinin compared to the regular product, and that generates a stronger immune response in the older people. Fluad, trivalent and quadrivalent, they have the adjuvant, and that again stimulates the immune system so that the older people have a good response to their flu vaccine. Next slide, please. For children 6 months through 30 months of age, we now have 4 products that you can use in this age group. When I started in this position 13 years ago, we had 1, only 1, and now you can see we have 4. So whatever product you choose to stock in your practice, make sure that you're using the right dosage. Next slide, please. Now, for children who are 6 months through 8 years, if it is their first time receiving flu vaccine, if they've never had flu vaccine before, they need 2 doses this season. And those 2 doses need to be more than 4 weeks apart or more. You don't have to use the same product. So if you start out your flu season with Fluzone and you run out and you have Fluarix, that's fine. Or you can, if you use FluMist, if the child is 2 years or older, and you use FluMist for 1 dose and you run out and you have an injectable product for the next dose, that's fine. You can mix and match so that the children get 2 doses of flu vaccine and are well protected. If the child's only had 0 or 1 dose of flu vaccine in the past, they need 2 doses this flu season. Next slide, please. FluMist is the live attenuated influenza vaccine that is sprayed into the nose. You must be between the ages of 2 to 48 years, and you have to be healthy and non-pregnant. Next slide, please. Here's a list of the FluMist contraindications. You must carefully go through each of these contraindications so that you do not administer FluMist to someone who should not have it. Next slide, please. Federal law requires that you provide the vaccine information statement to the patient or the guardian and give them time to read and ask questions before immunizing them. This is their informed consent. As I mentioned, immunize.org is a wonderful site for resources. These vaccine information statements can be found on at immunize.org, and they are in many different languages. And we have, on the left-hand side, we have the vaccine information statement for your injectable flu vaccine. And on the right-hand side, we have the vaccine information statement for the FluMist or the live attenuated intranasal spray vaccine. Next slide, please. It's also highly recommended that you use the appropriate screening questionnaires before you immunize. And these questionnaires, again, are found at immunize.org. They're in Spanish and English. The screening checklist on the left is for your injectable influenza vaccine, and the checklist on the right-hand side is for your live attenuated intranasal vaccine. Next slide. Okay, we need you to increase your practice's flu immunization rates. In the past, Nevada has not done very well. In the 2017-2018 flu season, only 39% of Nevadans were immunized against the flu. We need to do much better this year. So the first step in increasing your practice's flu rates are appoint an immunization champion. You need somebody to drive the process, to take ownership, and make sure the following things are done. Number one, institute standing orders so that the nurse or the medical assistant, whoever rooms the patient, can talk to the patient about getting their influenza vaccine and offer it right away before even seeing the provider. The second important thing is to use the presumptive approach to say to your patients, flu season is just around the corner. Today before you leave, we will administer the flu vaccine. 75% of people will take the vaccination if it is presented that way. Rather, do not say to them, oh, how about, are you interested in the flu vaccine today? That doesn't work. You need to tell them that they're getting the flu vaccine before they leave your office. Create and post your office policy so that your patients know that you and your staff are all vaccinated with flu vaccine. Set the example for your patients. Never miss an opportunity to vaccinate. If you have a teenager in there today for acne, remember to get them vaccinated before they leave. If somebody's in for a sprained ankle today, vaccinate them before they leave. Don't miss a chance. It is possible to convince vaccine hesitant patients to be vaccinated. If a patient says, oh, I'm not sure I want the flu vaccine today, ask them why. Listen to their concerns. And then you can reply how confident you are that flu vaccine is the best thing for them to get before flu season arrives. Have your clinic schedule nurse-only appointments so that you can vaccinate patients who don't really need to be seen for a visit. Alternatively, you could hold a flu clinic for your patients and advertise it. And the final thing on the list is reminder recall works. However you want to remind your patients that they need to come to the office to get their flu vaccine will work. You have to use text messages, emails, snail mail, phone calls, but many people, unless they're reminded, they will not return for their flu vaccine. Next slide, please. And that concludes my presentation. So, Brianne, I guess we'll take questions at the end, correct?
Yes, that is what we are doing. Thank you, Dr. Forrest. We appreciate your willingness to share your expertise with us. Again, any questions you may have for Dr. Forrest or Max can be typed into the Q&A box for us to address at the end of the presentation. We'll be wrapping up today's event with a presentation by me, Brianne Van Dyne, Education Manager for Immunize Nevada. It feels a little gratuitous to read my own bio, so if you'd like to learn more about me, please refer to our promotional materials. So in support of the information that Max and Dr. Forrest has shared, we would like to provide our audience with some resources related to flu vaccine promotion for the 2021 season. So along with the Nevada State Immunization Program, I wanted to quickly review what our goals are for this current flu season. So the first of which being and probably the most obvious is to increase flu vaccine access and uptake. We have hired 3 community health workers tasked with connecting with our northern, southern, and rural audiences to expand our efforts statewide for this purpose. We'll talk a little bit more about what that looks like so far as flu vaccine clinics and community presentations go, but that is goal number 1 of this flu season. Goal number 2 is to increase flu vaccine awareness and confidence. So this is around the areas of just bolstering the public's awareness of the importance of the flu vaccine, and then dispelling some of those common myths around the vaccine and increasing vaccine confidence for flu specifically. Our third goal is to strengthen partner and stakeholder relationships. So this is all about leveraging our community partnerships with many of you who are on the call today. It is truly going to take a village. This is not something that Immunize Nevada or the Nevada State Immunization Program can do alone. We need your help in addressing flu vaccine hesitancy and access challenges. Our fourth goal is going to be to increase outreach. So our target audience includes those that are vulnerable, at risk, and minority populations, and addressing those disparity in flu vaccination coverage, which has happened to overlap with the COVID-19 incidents as well. And then lastly, we will, all of these efforts are to say that we're going to use lessons learned from performing mass flu vaccination clinics, our messaging, and then our community outreach efforts to prepare for a potential COVID-19 vaccine. So a little bit about our objectives for this point in the presentation. We want to direct you where to go and how to get your flu vaccine, and then connecting those you work with to do so as well. This includes our target audiences that are both insured and uninsured, and just making sure that everyone knows where they can get vaccinated and how best to get there. Our second objective is to highlight the flu vaccine text reminder program. I think if anything that 2020 has highlighted is that we don't know what's around the corner. So I think we can, we'll take all the prompts that we can get. Our third objective will be to discuss our free flu vaccine promotional materials. These are both available in print and some of our social media messaging and those of our partners that we've curated. And then how to order those for your organization or clinic. Fourth objective is to discuss our community presentations. Immunize Nevada staff is available to make presentations to your community organization, both employees or clients that you serve, to discuss the importance of the flu vaccine. And then lastly, our call to action. What can you do to be a Nevada flu fighter? This is all about actionable steps that you can take to protect yourself and our community against flu this season. So first, where to go and how to get there, clinic locations. So our staff is regularly on the hunt for community clinic opportunities that we can post to our calendar that you see here. These clinics are both that of ones that we co-host and those of our community partners. So if you have any clinics that you happen to be posting, be it flu vaccine focus or just general immunization clinics, feel free to email Immunize Nevada, or I'm sorry, info@immunizenevada.org, and we're happy to post that to our community calendar. These are community clinics in addition to vaccination opportunities that you can partake in at your personal health care provider, a pharmacy for insured patients, and drive-through and limited capacity community clinics that we post here. We also have a where to go page where it identifies not just kind of these one-off community clinics that we're offering or publicizing, but healthcare providers and local health districts that can serve both insured and uninsured patients. Our AmeriCorps Vista member has created this flyer for uninsured patients. We're happy to email you the file if this is a resource that you think that would be helpful for the clients that you serve. It's available in both English and Spanish, but this helps, and it's Northern Nevada and Southern Nevada focused. So this one just happens to be the Northern Nevada version of the flyer, but we can absolutely send this file your way so that you can help connect those uninsured individuals in your life with where they can get vaccines of all kinds. We also wanted to highlight this transportation option offered by MTM Inc. Currently, Nevada patients, Medicaid patients who qualify are not able to make appointments online via this service, but they can call to help schedule transportation. If needed, there is a request that it occurs at least 5 days in advance. This is highlighting our text reminder program. We have partnered with Families Fighting Flu, who will be presenting on Friday of this week. So if you have not registered for that webinar, I strongly encourage you to do so. This is just highlighting the option to text Protect NV to 47177 for regular flu reminders. Obviously, once you get your flu vaccine, you can opt out of receiving these messages, or not if you just like to hear the latest happenings around the flu vaccine. But we thought that this was a great tool for just prompting folks to get their flu vaccine, as this is something that we know can get shoved to the side as other things take priority. Highlighting our free flu vaccine promotional materials for the print option. I just wanted to draw your eyes to the bottom left-hand corner of the screen. That is the site that you can visit for ordering our free materials online. I've highlighted our wall clings here. These resources are available in both English and Spanish unless otherwise noted. But through that free material ordering form, you can order these wall clings that are either catered to the general public or to healthcare professionals. We have bookmarks that are parent focused and children focused. We have our cards, the top 10 reasons to get a flu vaccine that is really applicable to the general public. We have stickers and buttons for clinics who are administering the flu vaccine, or if you just wanted one on your own to promote that within your general circle. We have a Post-it pad, I got my flu vaccine. This is was created kind of with the spirit of the Children's Miracle Networks, those decals that can be posted and displayed in very public areas, along the lines of what Dr. Forrest had discussed earlier, highlighting that your organization or clinic is promoting flu, that they are vaccinated. It just basically says, I got my flu vaccine, and you write your name on it and you put it on public display wherever you're employed. And then lastly, we have the CDC wash your hands sticker poster available. Again, all of those are available in both English and Spanish aside from the button. The second set of flu vaccine promotional materials that we have, again, if you look at the bottom left-hand corner of your screen, you'll be, if you use that link, you'll be redirected to a Dropbox location that houses various resources relating to communicating the importance of the flu vaccine. So we have tools for answering questions about flu. We have social media messaging around the topics of catch-up vaccination and the CDC's #FightFlu campaign. These are all sized and catered to the various social media platforms. So you can just easily, copy and paste. You don't have to be a social media whiz. I know a lot of us are tasked with monitoring our pages, and we may not know exactly what content to put. This is already ready-made and an easy way to promote the flu vaccine for your various organizations and clinics. It also includes clinic guidance for those of you looking to safely operate a flu vaccine in the wake of the COVID-19 pandemic. We have Immunize Nevada's flu vaccine campaign graphics there. So those are all Nevada focused. And then lastly, we have Immunize Nevada's and the Nevada State Immunization Program's action plan for this season. It goes a little further in depth into our target populations and key messaging, and then flu vaccination within the context of COVID-19 and why this year is so important for folks to get their flu vaccine. Immunize Nevada staff is available to make a flu presentation for any organization as part of meetings with clients or for employees. So just reach out to us at our info email or give us a call to schedule that. We're happy to do so. And then lastly, this is our call to action. So what specific actionable steps you can do to be a Nevada flu fighter this season? The first of which is perhaps the most obvious is to lead by example. So get vaccinated for flu. Post a gratuitous flu shot selfie, which we will happily repost if you tag us at Immunize Nevada and then hashtag #ProtectNV. Your second step would be to join Nevada's flu and COVID-19 task force. So we joke that it's less of a task force at this point and more of a small army. So we would love for you to join us in our fight against flu and COVID-19 by taking part in the task force. We need all various community organizations' input and expertise. So you could do that by emailing our general info email there. Third, practice other preventative measures to protect yourself from the flu. So this includes physical distancing, washing your hands, wearing a mask, cleaning surfaces, and of course, staying home if sick. And then lastly, host a vaccine clinic. So our team has become particularly adept at vaccinating or creating vaccination clinics in various locations. So we have linked to the clinic request form there at that website. And again, these slides will all be posted after the presentation if you're not a super quick writer too. But we would love to partner with your organization to promote a flu vaccine on site for clients you serve or for employees. And that will do it for Immunize Nevada's portion. We do have a few minutes that we are open for questions at this point. So if you've not already done so, please feel free to type those questions in the Q&A box on your screen. So the first question that we have is, do you think the practices of increased hand washing, masks, social distancing, and other COVID precautions will become sustainable, thus limiting the spread of respiratory disease in the coming years and won't just stop after COVID-19? Is there any push to encourage continuing these practices? I'm not sure that I could answer this. Dr. Forrest or Max, have you heard of any future efforts to continue to promote some of those other preventative measures? I mean, I know we were talking about hand washing for the duration of our organization's creation before COVID-19. So I know that that piece will continue to be strongly promoted, but did you guys have anything else to weigh in on that particular question?
This is Pam. I think we should always continue to use the hand washing, but who knows? Who knows what will happen with masks and social distancing? I don't have a crystal ball.
Perfect.
Yeah, this is Max. I agree with Dr. Forrest. It's kind of hard to say what's going to happen when COVID ends, but it's also hard to say how long COVID will be around or how long people will, be thinking about it. I think if you look at places that had other coronavirus outbreaks in the past, SARS or MERS, those countries that are affected, I think you would still see people wearing masks to this day. So it might just become a normal thing that people end up doing. Depends on how long COVID is around, but hopefully people will be able to associate, these precautions with health or infection prevention. So maybe people will just keep our fingers crossed. We'll learn to, wash their hands and be, I don't know, sanitary. I don't know what a nice way to say it.
That's what I had to laugh when we first entered the pandemic, and there was, all these bottles of soap missing off the shelves. I mean, I remember seeing a meme floating around that, were you guys all not washing your hands prior to the pandemic? Like, this is pretty concerning. So yeah, hopefully all of those precautionary measures will continue to stay in place after the pandemic is over. The next question was why, and this is a question for Dr. Forrest, why is the influenza vaccine and coronavirus vaccines unable to be administered at the same time?
When a vaccine is going through clinical trials, they're trying to prove that it is safe and effective. So right now they're immunizing tens of thousands of people just to prove that the coronavirus vaccine is safe and effective. At a later time, they'll have an opportunity to inject people during clinical trials with coronavirus vaccine and influenza vaccine. But until they can do that and study the outcome, they're asking people to just immunize a person with coronavirus vaccine only.
Got it. The next question is there a maximum number of weeks between the 2 doses of flu vaccine if given for the first time in like the 6 to 8 year age group? Dr. Forrest.
As with all vaccines, there's no maximum interval. There's only minimum intervals. So if you have a patient who's 6 months through 8 years of age and it's their first season for a flu vaccine, give them 2 doses, a minimum of 4 weeks apart.
Perfect. Yeah, so long as it's within that same season, they're good. The next question is what's being done to target healthcare providers in Nevada? It's known that their rates, immunization coverage rates for flu are the nation's lowest. I mean, we talked a little bit about kind of our efforts as an organization, but Dr. Forrest, are you aware of any efforts on maybe a national level to target flu vaccination rates among healthcare providers?
I'm not aware of any national program, but it's all over the news. Everyone's being encouraged to get the flu vaccine this year. When my staff and I meet with providers, we start our visit with information that Immunize Nevada prepared for us to show our providers what a poor job we're doing in Nevada to immunize our population. So we're working one-on-one with some providers, with our VFC providers here in Nevada. But nationally, I don't know what's being done individually.
And I know that certain healthcare systems make it a requirement of their staff working in healthcare systems to get immunized against the flu. So that would be another effort in addition to just the general education that Immunize Nevada is doing along with the Nevada State Immunization Program. The next question, if Fluval and Fluarix have trace amounts of gentamicin, since this is not listed as a contraindication, is it still a good vaccine for older persons who are likely to on this medication or a similar one? That's for you, Dr. Forrest.
There are flu products that don't have antibiotics in them that you could use. And if the patient's on gentamicin, that means they're not allergic to it. So giving them the flu vaccine with trace amounts of gentamicin shouldn't hurt them.
Okay. Maria, we will email that uninsured flyer for Southern Nevada Health District to you. Marcia has posted a Pershing County flu pod opportunity. I'm assuming to be put both publicized to our audience today and then also put on our community calendar. So we will make note of that along with the Lander County flu pod that's occurring. And then we had a thank you. So with that, we'll be wrapping up today's event. If you would like to view or share this webinar, the recording will be available on the Immunize Nevada website, along with information for future webinars and the rest of our flu focus webinars this week. Please visit immunizenevada.org/webinars for those details. And with that, we'll go ahead and wrap it up. Thank you so much to Max Wegener and to Dr. Pam Forrest for presenting today and sharing your information. To everyone who tuned in, we appreciate you and hope that you have a great day.
Thank you for having us.
Of course. Thank you.
Thanks, Brianne.